Before I start, I just want to say that lipedema is an actual condition, and yes, it does exist.
So lipedema is a fat storage disease that affects about 11% of the female population, and that's 370 million women worldwide. It was defined in 1940, but still most doctors don't know about it, most people don't know about it, but things are beginning to change.
Hi, I'm Beth Rylersdam, better known as Curvy Girl Beth.
Hi everyone.
My name is Gina Jean, also known as Thighs by Gina, and I have lipedema.
My name is Dr. David Amron. I'm the founder and the medical director of the Roxbury Institute in Beverly Hills, California. My practice specializes in the diagnosis and treatment of lipedema patients. I've been involved with lipedema for over 20 years. I've done over 3,000 surgeries on lipedema patients.
Lipedema, it's a chronic condition and it's an abnormal buildup of fat cells on your thighs especially, and it can also affect your arms.
I think like most women who have lipedema or are looking for an answer to what they have, at the beginning you really don't feel supported. You go to places and they tell you all sorts of conflicting answers. They might misdiagnose you with something else. They might even make you feel like you're just lazy and there's something wrong with you. So it's very demotivating and can really hurt your self-esteem.
Are you sure you're just not really overweight? No, never heard of it. You're just making excuses. I've never heard of it, so it must not exist. You know, you would be so beautiful if you just lost a bit more weight.
People assume that I'm just fat, that I'm obese. They don't know what's going on with my life. So it's this pressure, like always explaining what's going on with myself.
Yes, these are based on actual comments that have been said to me.
Lipedema is a disease that affects primarily the lower legs and is more commonly found in women.
Sadly, it mainly does affect women.
It's generally where an accumulation of diseased fat affects the lower half of the body from the belly button down, the waist down, sometimes in the arms as well.
In simple terms, it's where fluid remains within the fat cells and can block your circulation, can cause you heavy legs, severe swelling, lots of pain, bruising, and can actually decrease your mobility later in life if you don't take certain steps or change your lifestyle to help live with lipedema.
So there are 4 stages of lipedema, 1 through 4, with 1 being the mildest and 4 being the most advanced form of lipedema. But there are also several different types of lipedema. In the common type, there's a circumferential distribution of the fat around the entire leg from the groin area down to the ankle area all the way around. In that pattern, the upper arms are almost always involved. And some people also have additional involvement of the upper buttock area called the pelvic girdle as it swings around. And many patients may not have a column-like look to the legs, but more of a triangulated look from the groin area down to the ankle area.
So I heard about lipedema actually through a physical therapist that I was seeing for a concussion, and she, as part of her intake, she was asking me about my body. Was it always shaped this way?
So about a year and a half ago, I had never really heard of lipedema. It was completely non-existent to me. I'm really inspired by a lot of influencers on Instagram that do give me that encouragement and that drive to just keep going and accept my body, accept who I am, and say it's okay to look the way I do and be beautiful and be sexy.
I first heard about it on social media. I heard about it on Instagram. A few people commented on my picture saying that I may have this condition, and I also received a few messages from ladies mentioning about it. At the beginning I had no clue what is it about. Once I started researching it, I was almost 100% sure that I have it.
I first found out about lipedema by browsing Instagram. I had tried every diet under the sun. I'd been to doctors, nutritionists, health specialists, and all had told me just to kind of eat less, move more, and maybe get more sporty in the gym. However, after many failed attempts, I knew that something was wrong, as I could not lose weight on my lower legs at all.
So after a lot of sort of battling my conscience, I eventually decided to go and see a doctor. And I remember seeing this lady who thank God, had already heard of it. And this lady was so kind and lovely. She said, I'll tell you what I'm going to do. I'm going to refer you to the Oxley's NHS Foundation. And she referred me there, and the girls there examined me once more, and it was confirmed that I had stage 1 to 2 lipedema.
I noticed most people who were talking about it were either in Germany or in Spain, two of the hot hubs where people are doing huge innovations and research into lipedema. And that is how I stumbled across my doctor, who I arranged a consultation with in person in Madrid, and whom I flew to from Middle East to have a diagnosis. Very shortly after, I was diagnosed with very early stage 2 lipedema, which meant that I could book myself in for a surgery, which is one option if you have lipedema, or try preventative measures to stop it progressing, such as wearing flat knit compression, changing your diet, and changing your lifestyle.
I have been diagnosed at St. George's Hospital. I had to wait about 6 months for my appointment. Prior to that, I went to my GP. By the time I went to my GP, I had all the details about this condition, so I've asked to be referred to a clinic to get a proper diagnosis.
So I live in Los Angeles, and I am lucky because one of the foremost experts, Dr. Emily Eicher, is here. So I sought out her opinion for lipedema, and she did confirm that I do have lipedema.
I have to admit that it's not easy to live with this condition, especially because my body looks different compared to how other people look.
So it's a funny one, because when I was between probably the ages of 13 to 17, it did have a bad effect on me in terms of confidence, wanted to feel attractive in front of guys.
Apart from that, also the struggles with finding clothes that fit my body type.
For years and years and years, I really went through so many fashion crazes of finding, outfits, that suit my shape and whatnot.
For me, mine started when I was in my teenage years, and I noticed as you hit puberty, the first big hormonal change, that my legs were not the same as everybody else's, despite me being very active. I would cancel dinner plans, I might not want to go out with friends, my legs would hurt after walking around shopping, and it became a real inconvenience to someone who was young and healthy that I couldn't do simple activities that my friends could do because I would complain that my legs were so heavy.
The lipedema fat is so heavy that it really feels like you're kind of dragging around columns of cement all the time.
Most importantly, it can affect your confidence, and you can have extremely low self-esteem from it.
I have found ways to manage it through clean eating and exercise.
First of all, I have a vibration plate. It just basically shakes your body, and it helps get the lymph nodes flowing around your leg, particularly your thighs, your bum and your calves. If you do it daily, you'll see that it could have a tremendous effect. I've been using mine for nearly a week now, and I've seen some really big changes. My legs don't look as lumpy or bumpy anymore, and it's been the best discovery ever.
After I've been diagnosed with my condition, I started to read quite a lot about it and get in contact with people who know more. So I've been in contact with the charity Talk Lipoedema, and especially with my therapist, Karen Windsor. So I'm doing weekly therapy sessions with her. I'm doing reflexology. And also I'm trying to keep my diet under control.
Another thing I've been doing is dry body brushing. Also, one thing I have been doing is I have been avoiding eating gluten and stodgy foods.
I've also started researching a bit on surgery and to see all the options that I have. Last year I went to LA. I met Dr. Amron, and I've also assisted one of the surgeries.
Now that I've had the 2 surgeries, of course my symptoms are much less. The swelling, the pain, the heaviness, a lot of that, I won't give an exact number, but around 80 to 90% of that is gone. However, I do have to follow a strict lifestyle now, eliminating gluten and dairy. and trying to keep as active as I can to ensure that the lipedema doesn't be encouraged to progress. There's no real facts of whether it comes back or doesn't come back, but just being mindful that this is something you have to live with and work with, and it doesn't just disappear overnight.
I do think that I feel supported because of the relationships that I've developed with other lipedema women who have had the condition, and by going to different conferences have really helped me to get information from other experts.
Of course, Instagram has been a brilliant way to communicate with a lot of women with lipedema, and it's been a nice way to reach out for advice and comment, to talk to each other and say, oh, what method do you use? Oh, I never knew you could do that.
Instagram, of all places, has become a huge support network, and from discovering lipedema on Instagram and finding other women, I feel massively supported.
I remember I was on Instagram and I came across this lady called Iona Chira, also predominantly known as Iona Fit, but she is one of the biggest pioneers and advocates raising lipedema awareness.
When it comes to the support, I have to admit that from the lipedema community I have quite a lot of support. However, in my day-to-day life, people who don't know about this condition, they cannot offer any support, and at times I just feel judged, and that's where the struggle comes from, because people who don't know what this is, they just believe I'm simply fat, and that's it.
The most commonly asked question I get are women asking me if they have it, because they have all of the symptoms that we've all experienced.
If there is a cure for it, how do you go about it? Like, what do you do in terms of your lifestyle? And another question is how bad it will get. So people want to know how is this going to affect me on long term.
Two things that I've been asked the most about my condition. One is it genetic? And my answer would be that yes, it can be genetic in your family, but it can suddenly happen through things like puberty, the menopause, or pregnancy.
Does my lipedema hurt? I think that's probably the biggest question.
But the one thing I have been asked the most about my lipedema is, have you thought about having surgery? And yes, I have, many, many times. And I was close. I have got to that point in my life where I actually comfortable with my body.
I am very fortunate to have discovered my lipedema when I was age 29, and I was only at early stage 2 of the condition. This can progress to stage 4 and be a lot more aggressive based on genetics and lifestyle and age. So for myself, my mobility has not been affected. It was prohibited during those teen years and early 20s when I felt less able than other girls my own age. But now that I've had my surgeries and I know how to live with lipedema and look after myself, so far, so good. No mobility has been affected, and I hope that may continue with more research and more insights on how we can live with it better.
I do not have other diagnoses associated with lipedema. I know that a lot of people have a combination of lipolymphedema, but that's not my case. So I've only been diagnosed with lipedema.
As far as other diagnoses go associated with lipedema, I am on the spectrum of Ehlers-Danlos, as well as I do have sleep apnea at the moment, which is also often correlated with lipedema.
And lastly, no, I don't have any other conditions associated with lipedema. However, like I said, when it comes to your dietary rules, I do stay away from gluten and dairy. So I think that's something you have to really put together with lipedema, that it comes as a package. You have to accommodate those in order to help your lipedema.
Now, as much as lipedema is a pain for me, I actually do like the way I am.
So a few final thoughts. I want to say that if you think you have lipedema, or you may have lipedema, or you know of somebody who has lipedema, you're not alone. Many patients around the world are with you. But get involved. Get involved in increasing awareness for this disease. It's a very important thing. There's things you can do at home. Pay attention to dietary strategies for lipedema. It's a very important thing to help with prevention. Pay attention to swelling and compression therapy, compression garments for your lipedema. It's another important thing you can do at home. And finally, if you determine that surgery is a way to go, please contact me. I do virtual consultations, and I'm here for you. So anyway, God bless, and it was nice communicating with you.